Hi, everyone, and welcome to another Insight Tuesday. Hope you guys are having a good week. And for today's Insight Tuesday, we're going to be talking about, once again, a topic that you need to understand for your RHIA exam as well as your RHIT exam. And the topic for today is going to be insurances. You want to know the different types of insurances out there. Why? Because we deal with insurances for revenue cycle management processes. In order to receive payments, you're going to have patients coming in with their insurance cards, and they want you to understand the different types of insurances. So I'm going to go ahead and share my screen and talk to you guys about some of the important insurances that you need to know in order to do well on these certification exams. So feel free to join the room. I know people are still going to be coming in here, but in the meantime, I'm going to go ahead and share my screen. Let me go ahead and do that fairly quickly. And as you guys know, this is going to be for 15 minutes tops. So we won't be here for a long time. And you should be able to see my screen now. And you're going to see insurances on here. So let's jump right into this and talk about the first insurance that you need to understand for the RHIA. And that is Medicare. Medicare is a insurance that is used for patients that are 65 years or older. So if you're not in that age gap, you're not going to qualify for insurance. There is a caveat here where it also covers some younger individuals that may have disabilities and people that are also a part of the end stage renal disease, permanent kidney failure area or aspect where they may be doing dialysis or getting some type of transplant. Those are special cases where that person could actually, in fact, receive and utilize Medicare. So you need to understand who qualifies for Medicare, right? And that is the qualification: 65 years or older, or they have some type of disability, or have end stage renal disease of some sort. They qualify for Medicare. Next is Medicaid. Medicaid is going to be for populations that are considered low income adults, children, pregnant women, elderly adults, and people with disabilities. Those individuals can qualify for Medicare. Medicare programs can vary based on the state that you live in. That's a really good fact that you need to know for your RHIA and or your RHIT. So just know that Medicare can vary in terms of the qualifications and what it covers based on the state that the patient is in. Keep that in mind, but I want you just to think about Medicaid for those that are considered low income. There is one insurance type that I did not put in this presentation. It is called CHIP. Does anyone know that's watching here know who the audience is or what population would qualify for CHIP? Does anybody know? Anybody want to take a guess? Okay, and I am not seeing anyone respond. So CHIP is going to actually be for low income children, right? So they have Medicaid for families, but they also have CHIP, which is set aside for the babies. And so they are going to be the people that will be actually utilizing that CHIP insurance. So just keep that in mind. We covered Medicare, we had Medicaid, CHIP, which is not a part of this presentation, but is very important to understand. And we're going to now talk about another one, TRICARE. TRICARE is going to be insurance that is used for active duty and retired members of the military. They have their own special plan and they are covered through that insurance. So if you ever are working at a facility or you find yourself doing billing and you notice that the person hands you a TRICARE card, then you can automatically assume that this person has some form of military experience, or they have a family member, a nuclear family member, that is an active member of the military. So that is TRICARE, and you need to understand that for your exam. And the last one that I'm going to cover in our short time here is CHAMPVA. This can easily be confused with TRICARE, so I want you guys to know the differences between the two. CHAMPVA is going to be, and this is key, for the spouses and dependent children of veterans who meet some type of criteria. Now, the criteria is that this veteran needs to be permanently and totally disabled due to a service connected, meaning that they were actively serving in their role and during that time became permanently and totally disabled. It can also be for a veteran who may have died as a result of serving our country. In these two cases, their dependents and their spouses could qualify for CHAMPVA insurance. So we've covered TRICARE, we've covered CHAMPVA, and you should know the differences now between the two. We've covered Medicare, we've covered Medicaid, and we've covered CHIP. Remember these things, write them down. If you don't understand the differences, make sure that you do before you take your exam because they are important. So if this was helpful and you're looking for some more, information to help you as you're prepping for your exam, I do this every Tuesday. For 15 minutes or less, I will go over some content. So join me next week. And if you're looking for something more than a quick, 15 minutes with me, then as I say every week, I do have courses available that you can purchase and learn not just a little nugget, but everything that you need to understand to pass your RHIA exam. And so we do have these courses. They're currently on the screen, premium packages. We have standard packages. They'll all prepare you to be successful on this exam. We've had great reviews. Check out our social media if you want to, hear what people have said and seen their experiences. And we also have some other resources out there available. Weekly RHIA questions for those that are looking for RHIA questions. Just a lot of things going on, okay? So that's all the time I have for right now. Thank you for joining me in this short 8 minutes. And I want you to have an amazing week. And I will see you guys next Tuesday for a little quick insight into passing your certification. So bye, everyone. Thank you.